and what can be the solutions like. And along the path, I will be trying to tell you my experiences regarding what climate change and how the practice changed for me in last 44 years. Slide out. So this is the one booklet which WHO published on 10th October 2023 regarding climate change and human health. But this particular thing talks about more health problems in Western countries, especially in Europe and North America. But there are few things which are different for our own country, which we will be seeing now. So if you look at the climate, what is the climate? It's a composite and generally prevailing weather condition of a region throughout the year, averaged on series of years like, such as temperature, air pressure, humidity, sunshine, cloudiness, winds. So there are multiple factors which makes climate as the thing. And what we have done by human actions, we have changed the atmospheric composition, thereby leading to a global climate change. Greenhouse gases, which are being talked out quite a lot, they are producing increased temperature, and this increased temperature is giving rise to various bad effects on the earth climate, especially mid and high latitude countries, that is Europe. So starting from the Turkestan, Portugal and upward, it has reached right up to Sweden now. We'll see what the Sweden is facing now. And some part of Asia and Africa. In Asia and Africa, it's totally away or opposite end, that is droughts and less in the rainfall, leading to food scarcity. And we have seen the tropical cyclones in India, when the frequency has increased and has increased medical problems associated. So if you look at the temperature, energy, atmospheric composition, ocean and water and cryosphere, we have 7 parameters to look after. Those parameters are surface temperature, ocean heat, atmospheric CO2, ocean acidification because of increased dissolution of carbon dioxide, sea level rise because of the temperature and glacier getting shorter and shorter, and Arctic and Antarctic sea ice is getting dissolved. So what changes has occurred? The surface temperature has increased, ocean heat has increased, greenhouse gases have increased, sea level has increased, and with there is a reduction in the ocean acidity is becoming more acidic, glacier size is reducing, and sea ice is reducing. So what are they lead to for us? So if you look at this complicated thing, what we have said, these 5 things we have looked after. So this has led to slowdown of global thermohaline circulation, jet stream weakening, El Nino southern oscillation leading to increase in temperature. And that has high impact events like heat wave, cold wave, fires, drought, flooding, marine heat waves, tropical cyclones and coastal erosions. These are the effects of them. And it in turn leads to rising poverty, food insecurity, health issues, water scarcity, damaged infrastructure, rising inequalities, displacement, ecosystem collapse, biodiversity loss and conflict. Of this we will be dealing with health issues, but other issues also take a part into it. First slide, Miss Salika. So we should have started with this slide actually. So if you look at this, the New England Journal of Panic Inducing book. So when we talk about climate, what they say that with increased temperature can cause this and can cause death and leading to panic as such. So in this lecture, obviously we are not going to have panic, but we are just going to see scientifically what is the truth like. So whatever comes in newspaper is exaggerated version of tropical changes, which is not at all in practice as you look for. So what are the health risks which are associated with climate change? The extreme weather events, heat, sea level rise, air pollution, vector distribution and ecology changes with increase in insects population, water scarcity and reduction in food production. And this in turn will give rise to injury and mortality from extreme weather conditions, heat-related illnesses, respiratory illnesses, waterborne diseases, zoonosis, vector-borne diseases, malnutrition, food-borne diseases, non-communicable increase in NCDs, and mental and psychological problems, which will lead to effect on health system and increase burden on health institutions. Now we'll go in details of each one of them. So impact on human health is either direct, which is thermal stress, death, injury due to flood, storms, earthquakes, or indirectly through ranges of diseases which are vector-borne, water-borne, water quality related, air quality related, and food availability related. So if you look at the total parameters which they take into account, there are almost 95 parameters which we talk about. Of these 95 parameters, you include wind, humidity, clouds. Precipitation has become more and more common now, and cloud burst has become a more routine terminology. So we had cloud burst in various parts in India, in Ladakh, in Himachal Pradesh, even in Pune we had cloud burst and led to lot of medical emergencies. Ozone content with the increased use of fluoride and air conditioning, that is going down. Sulfur dioxide is taken in addition, deforestation, displacement, and ecosystem changes. So all these parameters, when you take into consideration, then you will have comprehensive the things regarding the climate. Now let us go one by one. The extreme heat. Extreme heat leads to more frequent, severe, prolonged heat events. Exposure leads to elevated temperature. Health outcome is heat-related death and illnesses. Impact is rising temperature will lead to an increase in heat-related deaths and illnesses. So what has led to? So if you look at the heat stroke deaths are on rise. After 2015, I couldn't get the statistics from the Government of India side, so it is up to 2015. In Maharashtra, it was only in Vidarbha we used to have it. Now last year we had in North Maharashtra also Nandurbar, Dhule, and even in some regions of Marathwada we are getting now heat stroke. Now heat stroke reporting has become a routine. We weekly report to the government, and heat stroke room or heat stroke units are being placed up in all the medical colleges. In Europe, what has it led to? Wherever there was ambient temperature above 5 degree, a rise in each degree of temperature led to rise in salmonellosis by 5 to 10%. So there is a epidemic of salmonellosis because of rise in temperature, and it has been related to that. 1 degree rise leads to 5 to 10% rise in salmonellosis. So there is an increased epidemic of salmonellosis in Europe presently. What have we seen with our H1N1 and influenza? If the maximum temperature is twice the minimum temperature and minimum is about 10 degree, we get influenza epidemic. So this is pretty well related that this environment leads to influenza epidemic, and we get all the viral respiratory illnesses, and when there is humidity more than 70%, and those are the months where we expect and we are prepared for tackling the respiratory illnesses. Next comes the outdoor air quality. Last week's Delhi, the air delays and all that is related to this. Outdoor air quality, increasing temperature, changing in precipitation pattern, worsened air quality, ozone, particulate matter, and high pollen count leads to premature death, acute and chronic cardiovascular and respiratory illnesses. Rising temperature and wildfire and decreasing precipitation will lead to increase in ozone and particulate matter, elevating the risk of cardiovascular and respiratory illnesses and death. So what has it led to? So these are the parameters on which we decide what is the air quality like. And we have this count practically available for each and every city now. And live numbers are available on the internet through the government. So good is 0 to 50, then it goes on worsening, hazardous will be 301. And in hazardous, general public at high risk of experiencing strong irritation, adverse health effects, and should avoid outdoor activities. So which are the greenhouse gases? Big three are carbon dioxide, methane, and nitrous oxide. So if you look at carbon dioxide, it is 150% more than pre-industrial level. Methane is 262%, and nitrous oxide is 123% high. Now carbon dioxide obviously comes from combustion. Methane is from degradation of organic products. So there is some politics going on over here also. It was blamed that rice field in India leads to increased methane excretion, and rice cultivation should be banned. So a lot of things went on to that, and then it was confirmed that methane production from rice paddy is not as high as they are talked about, and hence we can still cultivate rice over there. So each of these factors also have some political background associated. So whenever they come with any report, we should take that into consideration also. So this is yesterday's map of India, a live map of India for air quality. If you look at it, only in Ladakh it is green. Everywhere else it is yellow or something, some green over here, some green over here. But otherwise it is all red and yellow. And if you look in Delhi, it is 586. In Haryana it is 451. So this belt, so Haryana, Delhi, UP, Bihar has the highest polluted air. And this is available in the round the clock on by the software. So this is the air quality, and because of which there is increase in respiratory disorders. There was one paper from Delhi. Non-smoker CLR is in very high in Delhi, and the major blame is to the air quality. Then comes flooding. Flooding is because of, as we say, cloudburst, rising sea level and more frequent and intense extreme precipitations, hurricanes and strong surge in events. The contaminated water debris disrupt the essential infrastructure, drowning injuries, mental health consequences, gastrointestinal and other illnesses occur. Increased coastal and inland flooding exposes population to a range of negative health impacts before, during and after event. So if you look at the diseases which are spread by the flood, is acute diarrhea disease, fever, bleeding, rash, ILI, jaundice, but most important, snake bite. The snake bite suddenly increased, and this is what we saw when we had that flood in Pune, in Maharashinagar and Katraj area. The number of snake bites from that area reported were very high for next successive 3 days. Then conjunctivitis, injuries and skin infections. And these are the things which we need to report to the government after the flood. In 2005 Mumbai flood, I was there as an examiner for Sion for MD medicine, and Dr. Pazare was my co-examiner over there. It started raining, and it was so badly raining over there. So then we requested that Viva can be taken by internals, allow externals to go. But obviously the internal examiner said no, you have to take that also. We waited over there, and we were stranded over there for next 3 days. And we had to walk from waist deep water to catch a transport line. And thereafter you had lot of the illnesses which we will see. And some part of it is man-made, some is nature. So Kolhapur flood in 2021, this is there in climate change. Asha worker covering Kolhapur post flood, this is the lady. They showed spurting COVID-19, pneumonia, dengue, malaria, cholera, typhoid, leptospirosis were noted. So obviously floods are going to lead to increase in these diseases. Next comes the vector-borne. Vector-borne, here they have written line, we'll see why it is. Changes in temperature, extreme and seasonal weather patterns, earlier geographically expanded tick activity. Lyme disease is the one which is talked about. Ticks will show earlier seasonal activity and generally northward range expansion, increasing risk of human exposure to the Lyme disease causing bacteria. So this has been seen in Europe. So the first increase in movement occurs in ticks, and thereafter in mosquitoes and other insects. So tick-borne borreliosis, there was an epidemic of borreliosis in Sweden and Czech Republic, and there is sudden increase in tick population, and this was correlated to the vector-borne disease increase because of temperature. Leishmaniasis cases were reported, cryptosporidiosis cases were reported, and in the lower down in Turkestan, Portugal, a malaria epidemic was reported. So it is rising trend with the latitude, more the tropical diseases which were unheard of. Okay. So what we have seen over here, when I graduated in 1979, hardly any cases of dengue. 2005 we had Delhi epidemic. This was the first time I took a lecture for medical officer without seeing a single patient of dengue. And thereafter we had so many patients. In 2009 we had a huge epidemic in Pune, and it was associated again with the precipitation of flood and all that. And till today it has become an endemic one. Chikungunya, practically unknown till 2005, we knew that is a differential diagnosis of dengue. But that Marathwada cases, which occurred epidemic in Marathwada, then 2008 onwards we started seeing in Pune, and now we see couple of cases around the year. Malaria has no direct correlation, at least as far as my experience goes. What I have seen is every 5 years there is an increase and decrease in incidence, and it is not directly correlated to the climate change as such, which we can look out for. Scrub typhus, yes, definitely we have pockets near Pune. One is in Srivanda, another in Srirampur. And if the case comes from that area, we are sure, and when there is drought over there, the cases increase in number. That we have seen. The temperature increases, the cases increases. It definitely has a correlation. Now coming to the water-related infections which will be raised, especially Vibrio falciparum, which precipitates cholera-like illness, and this is seen in European and American country. So with us we have seen reduced number of cases as far as cholera is concerned, but those cases are increasing over there because of the temperature change. Leptospirosis, which occurs with the flood, is much more common now and much more rampant. 2005 flood in Kolhapur, there was epidemic. Mumbai, practically yearly they are getting epidemic of leptospirosis, even every the flood in rainy season. It was seen predominantly in South Indian cities, now has become yearly peak during monsoon. And this doxyprophylaxis was the one which was started by Maharashtra state. I was the member of that committee, and with that we could reduce the deaths to a great extent. So whenever there is a flooding is followed by doxyprophylaxis as a routine in Mumbai Corporation. So previously it was seen only in Kerala, then it spread to Tamil Nadu, now it is in Karnataka, Maharashtra and Gujarat. So the area is expanding for leptospirosis, and this again can be related to the climate change. Food related infections, food related like salmonella, increasing temperature that we have just seen in Europe how it is increasing, and rising temperature increase salmonella prevalence in food, longer seasons and warming winters increase the risk of exposure to infection. But whatever we have seen about enteric fever in India, the rate has remained static, hasn't shown a remarkable increase per se. Food scarcity produces migration, as we are seeing, from Africa to Europe, then from South America to North America. Starvation related illnesses, social violence is increase, and that leads to more deaths and injuries, and infective diarrhea increase because of the same. Then comes the mental health and well-being. Climate change impacts, especially extreme weather, levels of exposure and traumatic events like earthquake, flooding leads to stress, distress, grief, behavioral disorders, social impact, resilience will lead to the mental changes, and changes in the exposure to climate, weather-related disasters cause or exacerbate stress and mental health consequences with great risk to the certain population. So if you look at this, the number one is farmer suicide. The farmer suicide, 4,000 in last 3 years, maximum from Vidarbha, but now Marathwada is also contributing to the farmer suicide, and this is related to the drought, which is a climate related change. If you look at the antipsychotics, the sale has hiked to 270 crores, antidepressant 632 crores, post-traumatic stress disorder has increased in various study shows as high as up to 70%. So mental disorders are definitely on rise, and we all have faced it in practice. Anxiety, depression, mania, functional neuro GI disorders. The more migraine cases, more IBS cases we are seeing now, and this is related to the stress with climate change. Climate related uncertainties obviously adds to this mental changes. Now emergence of new diseases right from HIV, H1N1, H5N2, MERS, Corona, and more number of zoonotic diseases are getting spread to the human being because of climate change and the wild animals the interaction with human beings is increasingly occurring, and because of which we are getting new diseases. At least every 10 years we get new respiratory virus to affect. Now let us see what are the system disorder related problems. If you look at the pulmonary system, extreme heat, wildfire, pollen, extreme weather events, viruses will affect the pulmonary cystine and lead to asthma, COPD exacerbations, increase allergic disease morbidity, greater sensitization to pollen, reduce morbidity and mortality for viral disease. Coughing, sneezing, and these are the common symptoms which we have in Delhi today. And if you look, there was a study done by our Dr. Savi, respiratory physician. The persons who are staying in a busy square in the city versus periphery of the city. Obviously, the one who sit near the heavy traffic have all these problems. If you look at the climate change and cardiovascular disease, heat exposure will lead to hypertension, diabetes, chronic kidney disease, will see soon, heat strain, heat stroke. The insect borne can produce Lyme, Babesiosic, Chagas, malaria, dengue, chikungunya can affect heart directly. Air pollution again can lead to non-communicable disorders, and the mental stress will lead to even Takotsubo, the cardiomyopathy, and there is increase in incidence of myocardial infarction, heart failure, arrhythmia, pulmonary embolism, cardiovascular deaths. Neurological health, obviously we have seen the psychiatric health is problematic, Alzheimer's dementia progresses earlier, multiple sclerosis, we know UNTAP phenomena, rising temperature precipitates neurodeficit. So those are the things which are increasing. Again, stroke because of dehydration and traumatic brain injuries are increasing with that. Now climate change and renal health. So if you look at heat, dehydration, nephrotoxic agrochemicals, endemic infections, kidney stones will lead to renal injury, AKI events, and CKD. Urbanization and industrialization leads to physical inactivity, diet, obesity, fat stores, and pollution, which will lead to a non-communicable disease and kidney disease. Changing precipitation pattern lead to water shortage, flooding, obesity, insulin resistance, disrupted dialysis services, and non-communicable as well as communicable diseases. And pathogens, nephrotoxins, as Dr. Ambedkar has already talked on that, and vector-borne diseases leads to increase in kidney disorders. If you look at the cancer, obviously drought, wildfire, heat will lead to increase in lung cancer, skin, gastrointestinal, and to others, which includes the hematological cancers. Obviously, this is again due to pollution, cancer-related effects of the pollution, and behavioral change. So CLL in non-smokers and hematological malignancies, the figures are pretty high. Ecotoxicology is a new branch which has come up for the study of toxins due to climate change. Environmental toxins which will be increased release, degradation because of increased heat, transportation because of wind and cyclones, mobilization, dispersion and deposition due to temperature and wind effect. And which are these toxins? Algal toxin, mycotoxin, heavy metal, plastic, pesticides, and has led to liver disorder and hepatoma as the presentation. Now let us see what is the Indian situation. In Indian situation, weather patterns such as cyclonic disturbances, sea level has rise, changes in agricultural yield, sometimes you get more agricultural products, sometimes hardly any, changes in freshwater supply, impacts on forest and natural ecosystem, and impact on human health. What has been predicted in next 30 years, those which are in pink and black are going to face major climatic change, and there will be risk to the human population over there. The green, we don't expect much change in the climate, but the black and the red one is of highly impact zone. Now, what has changed? The average temperature increased by 2 degrees, lower frequency of rainy days, increased intensity. So, rains days have become less, but it is pouring much more during that particular period. Cyclonic disturbances, previously we used to get only east the side cyclones. Now we are getting west side cyclones also. The east used to be routine, but this west one is the one which is because of climatic change. Sea level is increasing by 1.3 millimeter per year on an average, and freshwater supply has high variability up to 50% increase to 50% reduction, and 10 to 30% increased risk of floods, increased risk of droughts. So obviously those are the things. Now they have shown this green as the area where you will have floods. But look at this, there is no area of flood, but still we had flood in Himachal Pradesh. Then we have flood in Rajasthan, flood in Gujarat. So the areas have been changing. So Himalayan glacier melting leading to flooding of the Ganga. Sea level rise, obviously we had 39 islands in Lakshadweep. Now we have 38. One was submerged. And variability in monsoon producing unreliability of food crop. So Himachal floods, we have all seen these pictures on the TV, and the great man as well as material loss over there. If you look at this Gulmarg in this December 23 and last December 22, see the change. The whole thing was covered with ice. There is no ice in this year, but now it has started pouring ice in last week. So which should have been there in December, it is happening almost a month later. So what are my experiences are with Koina earthquake, Killari, Bhuj. So Killari and Bhuj, we had a patient in Sasun which were transferred for management. They had severe mental trauma associated. When it was in Koina, I was in school days and I had visited a few places over here. When I went to Delhi as examiner, the examiner asked me, did you notice anything? It was nothing. There was an earthquake right now. And this was in AIMS. Now those people have become so sensitive. They realize it immediately. मराठवाड्यात काय वापरतात माहिती अर्थक्वेक ओळखायला? आफ्टर किल्लारी बैलाच्या गळ्यातली घुंगरं टांगून ठेवतात. हल्ली की अर्थक्वेक झाला. That is the simplest earthquake meter like. So Killari, Dr. Gore was director in our the Navale Medical College. He was there in his house when this particular thing happened, and then we went to help out him and all other his villagers. But it was a deadly scene. But what was worst is the poor sight of our people. After Killari, it was started, tourism was started over there to see how the collapse, house collapse, and how the people have been injured. So tourist companies started a tourism spot like that. So this is the example of worst mental status. Now cyclones we are seeing, the west coast we are also getting it now. Now what has it, on 7th June, we used to go for a trekking. Every year 7th June, all Meditrekkers is our group, used to gather at 11:30 night on station, catch a local and then go to the Rajmachi. That used to be routine for almost 10-12 years. But now on 7th June, there is no rain, nothing. It has been postponed to almost by a month. So previously in Pune, we used to get it on 7th June as a regular episode. Non-seasonal heat, rain and water changes have increased and agriculture has suffered a lot. Now, if you have all this, will we suffered with this, or we have some things additional? We can undergo adaptations. So adaptations to survive with low oxygen content and high pollution. So aquatic life has adaptations like increased intake of oxygen through increase in hemoglobin, affinity increase, transport increase. So those things may come up in human life further if the things deteriorates further. We know that in a hypoxic area like foothills of Himalaya, we have polycythemia and PDA common to combat for hypoxia. Similar such adaptations can occur. The dietary changes will definitely occur, but the people, as they make you panic that there will be oxygen chaos in every square to breathe oxygen, I don't think will be a reality soon. Now this particular program has been started by Government of India, National Program for Climate Change and Human Health, to reduce morbidity, mortality, injuries and health vulnerability due to climate variability and extremes of weather. And this has been started just last year. Okay, now the policy will be formed how to reduce and how to go ahead with this climatic change. So to summarize, if you look, changes in climate will lead to effects of climate change, health impacts, heat-related illness, cardiovascular disease, injuries, health, mental neurological disorders, zoonotic vector, and intervention strategies will be early warning, prevention and reduction of disease, community engagement, education, awareness raising, adaptation and integration. So what we can do for that? So can we reverse all these changes? Obviously no. Reversal is not possible. Can we maintain status quo? The industrialization is going to go on increasing, and we are going to produce more and more heat. And now the wars which are going on in the world, there are 2-3 wars going on which is adding to this particular heat. So status quo maintenance is also a difficult task. So what we have in our hand is to retard progression. So we can retard the progression by ban fossil fuels. So no petrol, diesel, coal. So that is the major source of CO2 and carbon monoxide. So we can reduce that. Decomposition of organic matter to reduce the methane production. So greenhouse effect will be less. Alternative source of energy and production methods like solar, atomic and others. Mechanical and biological solutions. Mechanical solutions like now we have electrical cars to reduce the pollution. The biological bacteria to act upon this organic matter to reduce methane production. So 5 R's which are being talked about is refuse, reduce, reuse, repurpose, recycle. So if we all go through for this 5 R and try to reduce the pollution, obviously we can retard the progression of climate change and human health will be saved. So act now for future generations, and with that I think that was the message I want to give you. Thank you.
Thank you, Dr. Dileep Kadam sir, for covering all the bases of such an extensive but need of the topic.